don't recall ever looking after anyone with sickle cell disease that I knew of or that I can remember before I actually started working at the Children's Hospital, and that was 11 years ago. But before that, I'd been nursing for a few years before that as well, and that was with adults, and I don't ever remember meeting any patients with sickle cell disease in my adult nursing career. So it wasn't until I started working in the day medical unit at the Children's Hospital that I first met a patient with sickle cell disease. So I think, whether that's because there's becoming more patients in Australia, but also in the adult setting, I wasn't in the haematology sort of area, so didn't ever care for anyone, but I don't remember learning a lot about it in our training either. So it's definitely something that is more recent in terms of my career. Yes, I suppose working in this dedicated sickle cell nurse role, it's allowed me to learn so much more about sickle cell disease. And then forming relationships with our patients and their families is a really important part of that care. And I think seeing our patients in the different settings, so whether that's coming into outpatient clinic, whether they're in the day medical unit for chronic transfusion or red cell exchange, and also the patients who come into hospital and are unwell and get admitted. And it helps to form this overall picture of the sickle cell patient experience. And I think that's really beneficial for a caregiver, because you can see that it's not just, what we see once a month in day medical or in outpatients. There's a whole other side of it. And when things are really bad, that's when you can learn a lot as well about the different complications and what makes things better for our patients and families. And that might not just be the medical care that they come in, but what we can do sort of from a social side as well. And just I think having caregivers at the hospital that do understand about their disease makes them feel a lot happier and safer, and as though someone understands their disease really well, which I think, judging from my early experience of nursing, certainly not a lot of caregivers do have that good experience and knowledge of sickle cell.